about the OSCEs which are concerned with the patterns of your chronosurgery. Then apart from that, some particulars from some specimens from your audiologies, not all. These will be covering in daily few steps so that monotony is not there. And a few other important OSCE stations will be covering. Today is will be a generalized sort of mixed type of OSCE. Okay, and it will not be a long session. Takriban around 30-35 minutes will be hanging around. So let's start with the first one. We keep on mentioning that there are few sets which are generally very important. Just a minute, do this. We keep on mentioning that there are few sets from which questions are very likely to be asked. So type 1 thyroplasty is one of them. Okay. So here you should remember 2-3 points. I'll just outline the important things. One will be the Ishiki classification. Second will be your type 1 thyroplasty. There should not be any confusion in the type 1 procedure. And if you are comfortable, okay, all 100% clear with type 1, then go to type 2. 99% chances are there that only type 1 will be asked. If you are bad luck and examiner wants to test your nerves, then it will be shifting on to the type 2. After completion of this, only type 2 should be there. Third question will be, what is Kaufman formula? This please don't forget. Just a minute, somebody else is there. Oh. Somebody wanted to join? No? So, this is the Kaufman formula basically. What is the window height and what is the window width? So that you should remember. Don't forget. And in the confusion, please don't make the mistake of writing centimeter. So this you should remember. So what is the window height? That is your thyroid LR height in mm. Please mention in mm. -4 upon 4 divided by 4. And this window width will be given by thyroid LR height in mm -4 divided by 2. So this you should remember and approximate what is in the males, what is in the females. So it is a very, it has been previously asked also, what is the Kaufman formula for this thing, and it is a potential repeat. Okay. So coming to this thing, what are the types of classification? You can basically broadly divide it to 1, 2, 3, and 4. That is medialization, lateralization, shortening, and somebody is there. Just a minute. Okay, so type 1 being the most important, that you should remember. Even the image of type 1, that this type of surgery is being performed, they might ask you that what are the steps, how you create a window. One point is this, how you create a window, one thing. Second will be your how you determine the formula. So how you determine that what will be the height and width of the window. So what name you have to write, that will be the Kaufman formula. And remember the dimensions. We've revised it multiple amount of times so that you don't get confused on that day. And third thing what they can ask you is, what is the common implant that you use for the thyroplasty surgeries? So can I have, again breaking the monotony, can somebody help me with any 1 or 2 names?
Montgomery implant.
Montgomery and something else? Gore-Tex. Okay, Cialis-Tec. See, Baki it will continue, hydroxyapatite and multiple other things are there. But Montgomery and Gore-Tex, please remember, they have a specific image associated with that. And in the Gore-Tex, we remember that Gore-Tex is used here also in thyroplasty, and it is used also in rhinoplasty also. Okay, in this I have included the image of thyroplasty one. Rhinoplasty one I include in the PDF when we'll be sending it. Okay. So what are the they might ask you advantage and disadvantage, but basically in the OSCE setup, it's highly unlikely they will go into the theory part of these things. They'll generally ask you identify the procedure, what is being carried out. One, what will be the classification which is there, that is Ishiki's classification. Only if it's only a 1 marks and they don't ask you to elaborate it, you can just write the name and get off it. And if they are it's of 2 marks or they're asking to elaborate, please write 1, 2, 3, or it's always better to write it. Type 1, 2, and 3, and 4. And third thing you have to remember, please don't use any short forms. Never use any short forms in your OSCEs, practicals, vivas, anywhere. 3. Fourth question which is likely to be asked, what is the implant that you can use, advantage and disadvantage, we all remember with this. we go ahead. Okay. So this is the Montgomery implant, the first one. Okay, the first one is the Montgomery implant. I'm sorry for the image quality which is there. And this is the Gore-Tex one. This can be placed in this thing. इस तरीके से मिल सकता है. And apart from that, it can be like a sort of crumbled paper type appearance is there. I don't know whether I got it or not. No. Okay. So it's a sort of crumbled paper appearance. I'll share that image also of Gore-Tex. And remember that Gore-Tex is also used in rhinoplasty. Okay. Now, third question over here is, what is Woodman's procedure? Basically, these all are your named procedures which will be helping in somewhere they will be helping either in medialization, somewhere it will be helping in lateralization. So basically, in this what we do is, that is the exposure of the arytenoid cartilage, and what we do is that there is a lateral neck incision which is given, and that's why like in the present day scenario, all these importance, they are only of historical importance. Okay, so just remember the name where they are used. 3 and fourth one, this is important. Okay, now they might give you a clinical history that 35-year-old male, he came with complaints of stridor, and on example there is this is the picture. They might give you endoscopy picture, they might give you a clinical picture, something like that, so that you see that both the vocal cords are adducted. Now this is the surgery which is being taking place. Now they might give you a GIF based question. They can give you an image like this, they can give you a small 10 to 15 seconds video, and they can ask you, identify the surgery, identify the procedure which is taking place. Number 2, what instrument is being used, and 3, like some 1 or 2 add-ons will be there. So I'm sure you would have guessed the answer of this question by now. Which procedure is it? Come on, Dr. Rohini, give it a try.
Kashima's procedure.
Kashima's procedure. And what is Kashima's procedure? Can I have somebody please helping me out with that?
Carbon dioxide used for
CO2 laser will be used. Okay, very commonly used for what? For chordectomy. बोलो जब तक बोलोगे नहीं तो like till the time you don't make mistake. Yes. ठीक है. So this is basically posterior chordectomy. Okay, so basically a part of this vocal cord they will remove. Okay, so that to create space for air to go inside, so that the patient's main problem that is taken care of. One. Over here only, when you go, please, Jesse CO2 laser, you remember, please revise the image of the scientist associated with CO2 laser, the wavelength of CO2 laser. Okay, so that will be your revision of one in all. So what is the wavelength of CO2 laser? Can somebody again give it a try?
10,600 nanometers.
Nanometers, lovely. Okay, so these 3-4 questions will go hand in hand. So basically what happens is that there is a relief of airway obstruction with preservation of voice quality. Basically it's like a temporary sort of setup, a procedure to give the emergency relief to the patient. One. And over here, Kashima's ho gaya. Please, I'll send the link also. Watch a small video also on YouTube. I'll share the link of surgery of this Kashima. So just go through a video which is showing the this Kashima's procedure going on. Okay. So moving ahead, these 3 things. Okay. So guys, this is image which is given to you, and they might give a clinical history of that patient comes with history of dysphagia and like he's not able to swallow. So they will ask you what is the condition, what is Killian's dehiscence, what is Dolman's procedure. So can I have the first answer please? Zenker's diverticulum. Okay, so what is Zenker's diverticulum? Let's see over here. Basically, there's a outpouching which is taking place between 2 weak areas. Okay, the upper one will be your thyropharyngeus. Like let's see this one. This will be your thyropharyngeus, and this will be your cricopharyngeus. So this is the triangle which is the weak area. So from here that comes out. So the perforation occurs here during forceful esophagoscopy. It's called as gateway of tears, and if it starts outpouching, that is the mucosa which herniates through it to form a pharyngeal pouch. This is called as Zenker's diverticulum. Okay, and who is associated with this? Identify the gentleman. This is doctor. I don't know whether you are a doctor or not. Gustav Killian. And why is he important? Father of bronchoscopy. So this question can be asked here also, and this question can be asked when we study about the esophagoscopes in the bronchoscopes. Okay, so in both the setup, the image of the gentleman can be asked. He can be remembered by a person with having a very wide forehead and a very pointed or this sort of nose, very odd type of nose. Okay, so just remember his image. He can be asked. He is the supposedly father of bronchoscopy. He did too much work in this field. Okay, coming ahead. So Zenker's diverticulum, we remember, we can identify with this thing. Now coming ahead, now they can again give you a clinical picture of the same patient. Now this patient underwent further evaluation. Now on further evaluation, these are the images. Okay, so initial image जो है, ये वाली है. This is the anterior image, and this is the lateral image. Now they can ask you what investigation is this? So this is video fluoroscopy, VFS study. So just have a look at how this thing looks like. Don't answer plain X-ray. This is X-ray finding. Okay. Now this patient is taken up for surgery. This is the surgical intra-op finding. Just have a look. They might attach it with a clinical vignette, or they might give it like this, something like this. So if history of this sort, and this is the outpouching which they are catching hold of. So this is Zenker's diverticulum which they are catching hold of. Okay, and this is a whole article basically on PubMed. I'll share along with you guys. You can read it. So it basically describes the Dolman's procedure. Okay, this was the third question which we were having. Okay, condition हो गया, Gillian's Daycells हो गया, and what if Dolman's procedure? I think 2-3 days prior we discussed about it. Can somebody please tell me what if Dolman's procedure?
Stapling diverticulectomy.
Yeah, endoscopic stapling diverticulotomy, and along with it, please remember the image of Veda's diverticuloscope or Veda's laryngoscope. You remember the image? Everybody remember the image, Veda?
Yes,
Yeah.
sir.
Yeah, and we'll be lucky enough that we get this as the first image in exam. So we all will hail the Lord that we get it bullseye. Sure. Moving ahead, ये हो गया, Gillian's हो गया, ठीक है. Now just see this image. ठीक है. This image, can somebody tell? This image is for
National Program for Hearing and Deafness.
थोड़ा सा I would like to change. You are right. Yeah, you are right, but अभी डॉक्टर साहब ने बोला, डॉक्टर उमा ने, that is the accurate thing. National
Program.
ठीक है. Don't use any short forms, okay? National Program for Prevention
And control of deafness.
ठीक है. This is the entire answer. NPBCD. ठीक है. So this is your 1 mark. Okay. Why is it important? Just see the image. ठीक है. Image एक बार देख लो. Then I'll move to the next page of this question. Saw the image? चलो आगे चलते हैं. Now this is the question, real life question of this image. ठीक है. Identify the logo for the program of deafness in India and what is the full form of the official program. Okay. So like we after seeing this image we'll be like a little bit in a fix. यार आता तो है, देखा है, but कौन सा लगा है? सब कुछ एक जैसा लग रहा है. तो what will be the answer of this first one? C. Okay. Everybody with me? ठीक है. When was this program started? So this is a very PSM type of question. So please remember some 2007. ठीक है. Remember this is the date of how to remember it. ठीक है. 2007 में क्या कुछ something happened in 2007. Important thing. Anybody remembers it? याद भी नहीं है. ठीक है. Just like that. In 2007 something happened. This NPBCD was a kick-off. Now what are the components of this program? Okay. So components of this program is again a PSM type of question. Okay. Just I'll write these 5 points, and then you all will decide that why this has to be given 2 marks. One thing is that there has to be capacity building. Then there has to be manpower training and development. And third will be your service provision. Then fourth will be your awareness, that you generate the awareness. And fifth will be your IEC. What is IEC? ESM?
Implementation, education and communication.
पहला वाला बस थोड़ा सा मॉडिफिकेशन है, इंफॉर्मेशन, एजुकेशन एंड काउंसलिंग या कम्युनिकेशन. मैं भी कंफ्यूज हो गया, इधर इट्स काउंसलिंग और कम्युनिकेशन, बोथ आर सेम. ठीक है. सो दैट बेसिकली इट इज PSM. टेलो सोचो मत, व्हाटएवर यू वांट टू राइट जस्ट कीप ऑन राइटिंग, बट देयर शुड बी 2-3 keywords which you should catch up on it. Write in point by format, you'll be getting full marks. Okay, but there's nothing new in this. There's no ENT in this, there's no ENT surgery in this, but somehow we have to remember and write it on for the day of exam. And coming to this fourth thing, which government agency is responsible? So please remember, थोड़ा सा ना it's different. Ministry of Social Justice and Empowerment.
ADIP is the criteria, I think so.
वो तो हाँ, ADIP is the criteria, yeah. ठीक है. तो moving ahead, please remember these two. ये जो दो हैं, this I searched about them. इसका मेरे को मिल गया, इसका मिल गया. What if this I was still not able to find. ये इन्होंने कहाँ से उठाया है करके? Probably some WHO or something like that. So see over there. This is again a potential question. Let's see this image. When is the World Hearing Day celebrated? What was the theme of World Hearing Day this year? Dr. Priyanka, you are not audible. May I request, please एक बार बताएंगे क्या बोल रहे हैं आप?
World Hearing Day 3rd March.
3rd March. Okay. So this is your. This is 3 March भी 0303 ऐसे कुछ करके याद कर सकते हैं. And what was the theme of this year? The theme of this year was this changing mindsets. So there are 1 or 2 questions which are basically out of the box. Okay. So I just tried to associate इस तरीके कुछ question. I think 1 or 2 sessions before it was asked. So just tried to associate what all the associated things which could be asked. This was the official poster of WHO this year. So remember this image, date and theme of this year. Exact full theme का नंबर मार्क्स ये था कि changing mindsets, let's make ear and hearing care a reality for all. So changing mindset you should remember, and if you are able to remember this last continuing phrase, please remember it. Okay. So again, World Hearing Day, WHO has given this logo. Yeah, they itself gives so many things and confuse everybody. So just try to remember this logo also. And this was the thing which was given in your first question. ये होने वाला first one. ठीक है. So this is basically HLAA. What is HLAA? They can even ask you what is the full form of HLAA. That is the Hearing Loss Association of America. Hearing Loss Association of America. So over here only just अभी इसे full form एक आ गया. OCNA का full form क्या होता है भाई? Somebody give it a try.
Otolaryngology Clinic of North America.
North America. तो आपने एक कर दिया. What is ASHA full form?
Accredited Social Health Activist.
I was expecting this. ठीक है. This is basically your. I'll update you exactly. That is American Speech, Language and Hearing Association. Okay. You are also right. I'm not saying that you are wrong. ठीक है. But वो PSM के that would be correct, more correct in the context of PSM. And when we are quoting this ASHA guidelines or something like that, na. So remember this also and write that also. I'll leave it to your wisdom. American Speech, Language, Hearing Association. Okay. So basically, you just have this thing, na? Like in what scenario are they asking the question? If it's that PSM type of question, like program के बारे में they are asking, so please write that full form of ASHA, what you just answered. And in case if it's in context of your audiology and more of that ENT setting, so this will be the answer. American Speech and Language Hearing Association. Okay. Now again one more thing. All hail Modi ji. This is some instrument. I was going through it. I was not aware that this is something like that. What is SOHM? There's something called as SOHM, which is basically a low-cost, non-invasive, battery-operated device that is screening newborn for the hearing impairment. I'm out of this hospital setting for the last 5 years. आप लोग के hospital में are you using this thing?
No, sir.
No, na? Okay. So we use OE only. This might be some variant of OE which sir has made with his logo, something like that. Please remember this name. There is something called Soham, and if your the NB guys, they keep one question with the blessings of government. So this can be one of the question. What is Soham? So just remember it. Okay. I also saw it on net. I was not aware that this something is like that. Okay. So इसके आगे बढ़ते हैं. This is again a like question which has been asked. So which test is being carrying out? OAE. No fun in telling. You all remember it. So what is 136 rule? बताओ कौन बताएगा?
लेफ्ट साइड से पे होता है.
नहीं होता तो है. What is 1, 3 and 6 rule? मतलब
both the marks of
3 is diagnosis, 6 is intervention.
6 is intervention. Okay. So one में you screen it. ठीक है. 2 में you diagnose it or evaluate it. And in the third part, that is by the 6 months, you have intervention should be there. Okay. But sad state of reality in my hospital also, like I work in a government setting, people come for OE for say 4 months, 6 months, whenever they wish. I was told that hearing screening kara lena. So that's the sad state of affairs, but that's how things go. Okay, so we are okay with this. Ek minute. Somebody wants to join. Just a minute, guys. Okay, so this is like this question has been asked multiple amount of times, and I hope that you know the basics behind this OE, that this is coming from the outer hair cells of the cochlea, or all those type of question that what is the mechanism of action of this OE. One. Second, how do you interpret OE, that is pass and refer? What do you do in your setting? So I'll request ki agar like if they ask general kind of question that what is the interpretation, so you can write whatever you follow in your institution. That if you get refer in OE, what you follow, that you again repeat it after 2 weeks after cleaning of the ear, something like that. And when you do better, you can remember that same protocol or the like this chart given in enable reference. I'll share this PDF of OE, that is basically this universal hearing screening of the newborn. Remember this image. Okay, 2. Now coming to this thing, what is the name of classification for this tympanogram? We all remember this thing. I'm not interested in these 5 graphs. Everybody knows what is A, B, C, AS and AD. Okay, 2 questions which are over here. What is the name of this classification? I'll write the name. The name is Zerger classification. Okay. And second is, what are the axes? X axis क्या है? Y axis क्या है? Now can somebody have help me out in this? हाँ, बता रहे कोई?
Y-axis is pressure, sir.
Y-axis is pressure, lovely.
And X-axis volume, I think.
Compliance.
I think
Compliance.
मेरा भी मैथ्स थोड़ा खराब हो गया. This is Y-axis, right? ये X है,
Yeah.
है ना? हाँ, तो X-axis is pressure. Okay?
Wise.
ठीक है? Yeah, are you getting or am I speaking the other way around?
नहीं, correct. Yes.
ठीक है ना? हाँ, see, this is the Pascal. Remember by the name of PA. ये नीचे है. Like I remembered it, I was having like too much confusion in this thing. I remembered it. Papa नीचे रहते हैं. Like he is grounded. So PA is like this, ground. तो Pascal वाला तुम्हारा जो है, Pascal is pressure. So pressure is x-axis. Okay. Ear canal pressure is your x-axis, and this vertical one is your compliance. Okay. So these are the 2 questions which you should remember. Apart from that, you all remember it. What is type A? So it's like the normal mechanism. Type B will be present when there is either a cholesteatoma, there is perforation in the middle ear. Although type of will present with type B, and type C will present in the OME settings when there is fluid in the middle ear. Okay, and these are the AS and AD type of curve. Otosclerosis, they might ask you that which type of curve do you see in otosclerosis? Okay, see again 2-3 questions over here. Like वो must know type का होता है ना. When you get fed up of studying your Guillaume's commas, try reading your again SSNHL, that is sudden sensory neural hearing loss, very important. Meniere's disease, this is important from point of exam. And third will be your otosclerosis. These 3 and fourth will be your SCCD, superior semicentricular canal dehiscence syndrome. Okay, so from these they can ask various like your multiple topics in your Viva also, OSCEs maybe यहाँ से उठाएंगे, they'll ask multiple images, multiple drugs from these sections. So these are not very important from your practice point of view, but from exam point of view, when you get fed up of studying CM's commerce in otology, please revise these things. Whatever notes you have, otherwise thought prone, ये 4-5 चीजें पढ़ते रहना है. So in otosclerosis, they will definitely ask you that. Those type of questions. Okay. So, okay. Now coming over here. So identify this vamp.
Cervical.
Okay.
CVAM, cervical vamp.
This is of two types: C-vamp and your O-vamp. So just try to see this position of the electrodes. They are important. Okay. So this is your sternocleidomastoid muscle where they are putting the electrodes in C-vamp. Rest all remains the mota remains the same. Second will be over here. This is the infraorbicularis area below your eyelid where they are placing the this on your O-vamp. In the O-vamp, two things which you can remember. After this, first thing is to identify what is C-vamp, what is O-vamp. If you are not able to identify, don't jump on the next step. First thing, identify what is being carried out. One, differentiate. What is C-vamp, what is O-vamp. C-vamp में इन्होंने cervical पे रख दिया. वैम्प पे इन्होंने full form पता होना चाहिए. That is vestibular evoked myogenic potential. Don't make a mistake on these basic things. Now, after you identify what is C-vamp and O-vamp, second thing which you should know is from where is it arising? What nerve is responsible? So for O-vamp, this is your superior vestibular nerve.
C-vamp is inferior vestibular.
And इसमें तुम्हारा inferior आ जाएगा. Now, after you go with this thing also, third thing will be your reflex position. Okay? Don't directly jump upon कि I am reading vamp. I will read about the reflexes and I will read about the graph and chart. So we are not becoming audiologists as of now. Once you come into the practice, these all things practically become useless. You have to send it to somebody else. Okay. Okay. And this is your C-vamp. So C-vamp is basically this carries this vagus tract, and we saw that this is we are placing it over the sternocleidomastoid muscle, and by placing this pause, and ठीक है.
These days, M-vamp is also being done.
This is something new. Please elaborate, doctor.
It's a mesenteric vestibular evoked myogenic
Okay.
potential.
So basically, इन्होंने C-vamp से like the last line which is mentioned in this article, that C-vamp responses can also be derived from masseter, triceps, and gastrocnemius muscles. So they have probably ऐसा कुछ होगा. I've not read about it.
Actually, I attended Dr. Srinivas Vertigo course, and that he told.
Definitely. So these are the recent advances which are not there in books. They might occur in some journals. They might occur in some research papers and all. Okay. So this is one new add-on for today for everybody. Okay. अब इसके बाद three things I want to discuss with you guys. One is after your vamp, we'll be having BNG. How to identify. This will be on your next class. How to identify and what are the plus and minus of this thing. And second, audiological investigation which will be including is your ABLB. ठीक है. ABLB में 2-3 things are there which I would again like to share. This is my personal take on these things. If somebody is interested in this thing, you should definitely go into the details and nitty-gritties of these things. There is not very much need of trying to learn the interpretation of these things. At our level as a third year resident appearing for the exam, interpretation of PTA, interpretation of tympanometry, interpretation of Bera. These three things, if you know, you will be good to go. But in exams, you will face these type of questions that they will give you graph of VNG. They might ask you what is the interpretation. They will give you a graph of a laddergram of ABLB. And ask you what is the hearing loss in this year. So that's I leave up to you. For our setting, how we did our residency, it all depends how you are trained in your residency days, है ना? So we did PTA ourselves, we did tympanometry OE ourselves, we did Bera ourselves. So we were confident in these things. But these VAMP, BNG, ABL, they were not available in our hospital setup. So we were just read for the exam and forget it. So we're not very comfortable in these derivations, कितना उसका value आ रहा है. Exam के लिए you remembered ratified it and then forgot it. So my take will be that for that 1 marks of question, if you are confident, if you have done these things in all your last 3 years, definitely you should revise it, be ready for it. But if you guys have not gone through these things in your institution, so for that 1 marks or 2 marks, please don't brainstorm yourselves. That I'll read about everything about BNG. I'll read all the things about them, how they are calculating, how is ABLB calculated, how is the DICE score calculated. So that I would like to withhold you. Okay, on a 4 marks question, even if they give 1 marks or 2 marks question, you can definitely have a safe side. नहीं आता तो उसको छोड़ सकते सीधे सीधे. And 2 हो गया. तीसरा 4 चीजें अगली सेशन के लिए will be going upon. This will be your DICE, drug-induced sleep endoscopy, and 4th will be your laryngeal electromyography. Okay. So for the Friday session, please remember, please read upon these 4 things: BNG, ABLB, DICE, and laryngeal electromyography. And 4th thing will be your maxillectomy. Okay. Anatomy of maxilla. 2 things over here. Anatomy of maxilla. So that we'll discuss. We'll touch upon CA maxilla. That the questions which have been asked from that section. And what are the types of maxillectomy, what are the cuts of maxillectomy. This has been a potential question with all the related OSCE related. And after that, 2 more bones will be related. One will be there, one will be your mandible. Not in this, after this. Mandible and sphenoid. Okay, so and base of skull, obviously revision of this thing, because this is not, base of skull is boss of everything. So base of skull, definitely you should be thorough with that. All the foramina, anatomical foramina, radiological foramina, what all passes with through everybody, what are the boundaries of foramina, and what are the syndromes associated. So this is one question you will be getting definitely 4 marks, no doubt about it. So apart from these bones, maxilla, mandible, sphenoid, and base of skull, like इनके अलावा अगर if you people are thinking of doing something, please let me know. We'll try to include in this thing. And इसमें mandible में we'll be including this cuts of mandible, all the classifications of your mandibular defect, and recon of mandible. These 3 things will be in the next session. So for next session, please read upon these things: BNG, ABLB, DICE, electromyography, and maxillectomy. Okay, and again that will also be a short session, 30-35 minutes. And after that, 2 sessions will be left. We'll be revising the HPE, there are few are remaining that we'll be discussing, scientists and instruments. So after these classes, 3 classes will be remaining of your instruments, scientist and HPE. इसके अलावा कुछ revision के लिए रहता है, please let me know, we'll include it in it. We are still ahead of time. DNB is so much, I don't know why they are not declaring the results. So we all are getting time. After the results are declared, 3 weeks will still be there for revision. Okay? तो अगर कुछ भी आपके साइड से लग रहा है कि we have to repeat it again या something like that, please let us know. Okay, so any doubt in of this today around 10-15 of which we discussed?
It was supposed to be 1 class na, for audiology and osteology also.
Yeah. So इसमें what I had thought was like clubbing everything, all maxillectomy, mandibular, all the things of mandible, sphenoid, base of skull. So that becomes very taxing. This was my last year's experience. So that's why I thought to divide it into 2-3 classes. Maxillectomy एक में किया, mandible एक में किया, sphenoid एक, इस तरीके से. So if you want it in one, we can definitely go with that. Not an issue.
No, sir, this is not. Let's divide it in sessions.
See, let me very frank with you people. I always think that I am still on that other side of the table. I had difficulties in these things. That too mugging it up in a single go. So it was like हाँ समझ में तो आ गया, and after you stop revising, it was like okay, everything remains the same. So that's why these things, I think that some sort of breaking or differentiation might help you all. But if you have different opinion, please let me know. We should all be on the same ground. So we'll discuss these 5 things on Friday. Be prepared. Short class, revise, and all the OSCE tuck and out. And for the next one, we'll discuss कि अगले Monday को अपने को क्या करने का, ठीक है? So, if any points, please let me know, है ना? And keep on pushing hard, because अभी last 3-4 weeks है, and you shouldn't lag behind. And now is the time to gain your momentum. Till now it was all that tortoise session, daily studying, but now you have to gain momentum slowly and steadily, so that as soon as your results are declared, you all will be throttled with your this thing, and keep pushing it. Siom's commerce is the boss, like father of everything. Don't mess with it. Every alternate day, give 30 minutes to it, so that you are through with that 150 marks in that main final exam. Okay, and we'll keep on discussing the important topics also. It's not that after these 4 classes got sober, I'll leave you guys. जब तक exam नहीं होगा तो we'll make it functional. We'll remain functional, that group. So daily we'll be discussing the topics daily. Okay, like today suppose in the morning we'll put कि today we'll discuss CSF rhinorrhea. So revise your CSF rhinorrhea. शाम को 9 बजे we'll get around 5-10 OSCEs which are there of CSF rhinorrhea. देखा एक बार खटाखट. You are through with that. Next day we discuss something else. We discuss flaps of this thing. Head and neck is multiple things are remaining. See, howsoever anybody tries, there are multiple things which are left behind. Okay, so that definitely जब आप second look, third look करेंगे, like I'll also go through the PDFs again. Something is left behind. You'll be sending it again and again. Keep on revising. Keep on gaining your momentum. Keep on working hard. Don't let a single day also go wasted from now on, because it's maximum time of 4 to 5 weeks from now. अभी it will not be delayed more than first week of September. जो पेपर होगा first or second week of September में हो जाएगा. इससे ऊपर नहीं होना चाहिए डिले. ठीक है, चलो let's see and hope for the best that they declare the results fast. And any input from your side are most welcome. ठीक है, we'll meet you on Friday with these 4 topics. Okay.